Well, we're entering the time of the year where flu starts to take an impact on our community, and in addition to COVID-19 and other medical issues, a lot to think about for yourself individually, as well as your family and the community around you. Here to talk about those kinds of issues is Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates. Dr. Taweel, thanks for being with us again.
Thanks for having me on as always. How are you doing today?
I'm doing all right today. How are you?
I'm getting there.
Good. Always good to hear. So here, as we mentioned, we're in about the time of the year where flu starts to become a little bit of an issue here in our communities. Of course, the seasonal flu we hear about every single year, and the flu shot. For some people, there seems to be two camps. There's the people that get the flu shot religiously every single year, and others that may take a year off or several years off and think, well, it's just a slight variation of the year before. I should be fine. For those that are reluctant to get the flu shot every year or just kind of blow it off, what do you say to that population about the importance of getting their flu shot and how that can help protect them, given the ways that flu changes year to year?
Well, I think the one thing I usually tell patients is that the last thing you want me as your physician to say to you is, I told you so. Usually that means something bad has happened. So typically, you want to make sure that patients are getting their flu vaccines. Skipping a year means you're just at risk as anybody else. Getting the previous year's flu vaccine is not going to protect you to this year's flu vaccine. So, the inconsistency is not always going to lead to good outcomes. Your risk of getting flu is significantly decreased by when you receive the flu vaccine, and you want to reduce not only the risk of getting it, but also the severity of it should you get it. And nothing's been proven to be more effective than the vaccine at this point.
And so when you get that vaccine, people are also concerned too with the traditional flu vaccine that, they're giving me the live virus. I might feel bad after I get the flu for a few days, and it's almost like I have it. Wouldn't it just be better for me to not have that protection from that vaccine and just, get it naturally if it's going to give it to me anyway? What do you say about that argument? What are the flaws in that argument that we hear so often from people about the flu shot?
No more often than I do hear it. I'll tell you that much. Well, the reality is that, yes, your body does mount an immune response when you receive the flu vaccine. You do feel a little fatigued. You do feel a little bit out of it, and it does last for a few days. However, the severity of disease that you get from the flu vaccine is extremely mild compared to what would happen if you were to just get the flu itself. And, you don't want to add any more problems onto your plate right now, specifically with COVID still happening and new variants of COVID coming out. You want to do everything you can to try and reduce the risk of getting something that's going to put you out. And no one wants to be out any more than they already have been. So I think the reality of the situation is that the flu vaccine does give you a mild reaction, but that reaction is your body gearing up to protect itself from when you were to actually be exposed to the flu. So it's definitely a good thing, and it's definitely something that people would want to do.
And Dr. Taweel, we're also seeing that early on this flu season, it's having quite the impact in Australia. And so what can that tell us about what this flu season might be like in terms of forecasting that? It's already having quite the impact on Australians. What does that maybe mean for us here in the U.S.? Are medical professionals expecting this flu season to be a little bit more severe than it's been in years past?
I do. And I've been seeing more severity of illness in general. I mean, a lot of viruses that are going around. RSV has picked up, a lot of with the allergy, the change in temperature, the allergies that are kicking up. People are getting more sick. I think Australia is a pretty good indication of what we're going to be expecting. And I think it's going to be a pretty rough flu season. I also think the drop in contact precautions that have occurred are definitely going to lead to more infections of the influenza virus, as well as possibly more infections with COVID. So I do think it's definitely important to try and put every type of weapon in your arsenal in the protection against getting some sort of terrible virus.
In terms of COVID-19 boosters, just to continue on the theme of vaccinations for a little while, we've seen the new boosters come out recently for the Omicron subvariant, for Omicron's subvariants that have become more dominant strains of late, and we're continuing to see more and more boosters. On the other side of that, we're also seeing, in terms of public defense against COVID-19, a lot of those precautions that we had early on in the pandemic, even a year ago, have gone to the wayside. And in some cases, it seems like it's a very relaxed approach to COVID-19 at this point. What are the flaws, if any, that are in that approach? And what really would you suggest, and other professionals in the medical community like you suggest, for people in the population at this time, given what we know and where we're at with COVID-19, to prevent further spread of the virus throughout our communities and prevent severe disease?
So Omicron came through, and Omicron was a little bit more elusive to vaccines. It was also elusive to some treatments, but at the same time, it was a much milder form. So I think a lot of people picked up COVID or saw people that they knew that had COVID and had the Omicron variant and saw that it wasn't as terrifying as it was portrayed. So they felt to themselves, well, this isn't that big a deal. So they ended up kind of being a lot more lax in things. If I get COVID, it's not going to be that bad, or I already had it and therefore I'm okay. People, when they say I've had COVID, therefore I feel like I've already built the antibodies to it. That's kind of like saying, well, I don't need to wear a seatbelt because I've already been in a car accident. And that's just not reasonable. I feel that the new variants that are coming out are going to be a lot more significant and severe. And I think that people still need to be aware that there are variants of COVID that are coming out, and there are variants of COVID that are still out. I've had patients get it multiple times, 2 to 3, even possibly 4 times. So you want to make sure that you're doing everything you can to protect against that, because ultimately we're going to see a variant that's not going to be as pretty. It'll probably be as dangerous as the previous ones. We're already starting to see spikes in hospitalizations, new variants that are coming out. The new bivalent vaccine that's basically been put out has the Omicron variant spike protein, but also has the previous spike protein that was absent in the newer vaccines. And that has been shown to prevent people from getting COVID again, those that have waning immunity from having a previous, infection from COVID, as well as protect against the newer the variants that are coming out. It's been shown to be a little bit more effective. So hopefully, I encourage everybody to get new vaccines, including the bivalent vaccine, as well as even if you've had COVID or previous vaccines. I want the new boosters to be in everyone's arms if possible. In addition to that, just to maintain the typical contact precautions, even more so during flu season, because we've already shown that as we were diligent in making sure we didn't get COVID, we've also protected ourselves from potentially getting the influenza virus. So I think it's a win-win.
Let's continue on with Dr. Jeremy Taweel from internal medicine specialist at Grand River Medical Associates on today's edition of the Megacast. Another important topic that has been getting a lot more attention of late in the last couple of years, and really has had some changing precautions and recommendations directed at it, has been approaches to getting colonoscopies regularly for people of certain ages here in the U.S. and around the world. The information on that has changed. And in the past, it's been a more middle-aged and older individuals that were suggested to get colonoscopies regularly over a variant of time. But that age has actually moved back a little bit in recent years.
Mm-hmm. We're seeing a new surge in younger people that are getting colon cancer. So we're starting to be a little bit more diligent about preventable cancers. And preventable means we can catch it early, we can get rid of it, and we can prevent people from dying from it. And the studies have shown conclusively that people that get routine colonoscopies or colon cancer screenings, either through colonoscopy or through Cologuard, which is a stool-based DNA study, have been able to reduce their risks of getting and dying from colon cancer. I'm sorry, forgive me. The lowering of the age is to just be able to catch more people. So the new previous guidelines were at age 50, the newer ones are at age 45. So by lowering the age to 45, we're able to capture things a little bit. The earlier you catch something, it's much easier to stop a truck going 5 miles per hour than it is going 100 miles per hour. So if we're able to catch it at that 5 mile per hour speed, speaking, it will definitely reduce your risk of potentially dying from colon cancer, preventable disease.
In terms of frequency of those procedures, has that changed too with the age suggestion?
So it's typically every 10 years if you have a normal colonoscopy. However, if polyps are present, now I always say this to patients, and my mentor taught me this, not all polyps become cancerous, but all cancers start as a polyp. So if you're able to find any polyp and remove it, you can determine whether or not it's a dangerous polyp, whether or not it's a safe polyp, and it ends up being a little bit more beneficial for the patient in the long run. So if you have a colonoscopy and polyps are visualized, then they narrow that window down to roughly 5 years, give or take. And based on the pathology of the polyps, are they dangerous, or are they are they just basic polyps, or are they more aggressive polyps that have the higher potentiality to become colon cancer? Then they're going to move that up to 3 years, and based on the number and size and type of polyp, even up to 1 year surveillance colonoscopies. So they get more diligent as the things they find.
We're joined by Dr. Jeremy Taweel from Grand River Medical Associates on today's edition of the Megacast. You can get in contact with them by going to their website at grandrivermedical.com. That is grandrivermedical.com. You can also give them a call, 248 264 6169. 248 264 6169 for more information. Dr. Taweel, anything else that we should be keeping aware of individually or as families at this time on the medical front?
No, it's tough to give advice in these scenarios, but my common advice is always the same. It's going to be that an ounce of prevention is worth a pound of cure, and it is very easy to focus on the things that are right at the forefront, and we are focusing on that. But I also want to make sure that patients are doing all of their regular routine screening. We did talk about colonoscopy, and there's a bit of a backlog from all the people that put it off during COVID. Same with mammograms, same with pap and pelvics for gyne screening. Things like that. We want to make sure that patients are still doing the regular routine things and they're not getting sidelined by the tragedies that are happening currently in the world. We are still keeping a very close eye on that. We encourage people to, but we also want to make sure they're still getting in to see their doctors. And they're still getting all of their routine screenings, getting their blood work, and they're making sure that they're in contact with their physicians to make sure that we are all doing our job to make sure everyone's doing well. We want to keep it going. So I say just continue with contact precautions as best you can. Do the best you can, be kind to each other. That's about it.
Yeah, we've learned a lot over the last few years about different ways we can protect our health and the health of others around us. And of course, I think more than anything, we've learned it's really important to ask questions when we have them and we're not sure what to do to better protect our health and those around us. And a great person to go to is your primary care provider, people like Dr. Jamie Taweel. Dr. Taweel, thanks for joining us today.
Thank you for having me. As always, I really appreciate the opportunity to speak with you guys today.